I guess just to start with the testing piece of this, certainly we've seen cases come down here in the Northeast and states like New Jersey. But as we've seen the surge of COVID in other parts of the country, particularly the Sun Belt, and we get more of these reports that there are testing backlogs, how concerned are you? And is Atlantic already being affected by it?
We're very concerned about the testing situation. I've said to you before, it was a problem. It currently is a problem and will be a problem, and that hasn't changed. The average time right now here in New Jersey to get a result is about 5 days. Now, we're fortunate at the Atlantic Health System. We've made a lot of investments in different testing platforms, so we're able to do some of our patient activity, particularly those that are very high priority, like inpatients or our team members, and get results within a day. But generally speaking, it's a big problem, and this is going to get in the way of reopening businesses if we don't get it right.
So you think it's going to get in the way of reopening businesses? I mean, that's my next question for you is, as we are starting to see these phased reopenings in parts of the New York metro area proceed and move forward right now, and as you do start to see more people migrate around the country in general, is it inevitable? Are you preparing for another uptick in cases here in the Northeast?
At our peak, when we spoke in actually April, we were seeing 900 inpatients a day in our hospital, taking care of over 11,000 COVID patients. Today, we have 20. So I am hoping that we stay at that level, but I'm realistic enough to know that the surges we're seeing across the country are problematic for 2 reasons. One is transportation, because if you recall, the migration of this virus into northern New Jersey came right out of New York City, followed the transit lines. Again, we're going to see that crossing borders and coming in. That's why the work that the governors have done to try to restrict travel here into the tri-state area and sit in quarantine for 2 weeks if you're coming from certain areas is important. But we also know that as we open up a bit and people are interacting more, we're going to see transmissions. The most important thing that we can do as a partnership with our state governments is get on those outbreaks quickly, and that requires testing, which is why it's so very important.
Well, Brian, it's David Faber. Let me come back to that, because you've mentioned it any number of times. I mean, we watched the March 12th clip of you saying it's a big problem, and I just heard you now say it's a big problem, more than 4 months later. What gives you the confidence, given our inability to potentially get on top of this over the last 4 months, that we're going to be able to do any better?
So there are a lot of efforts underway by a number of the testing companies to try to create more platforms, to try to create more supplies like reagents and transfer media and things like that. But the fundamental problem we have is we have a patchwork of systems that exist across this country and across the globe. Imagine in your kitchen if every device you had a different plug, and you were trying to figure out which outlet you had to plug that appliance into. That's the situation we have with testing right now. So one of the most important things that we can do is to begin to consolidate the supply chain in a way that we can have an adequate element of the different supplies that are required around the journey here, and get those in place. And I think that's a role that government can play, is beginning to put some standards on this. But to date, we haven't seen that activity. So just short of creating our own supplies, short of working very deliberately with the manufacturers, which is what we're doing, we're going to continue to suffer from this. And I think that is our Achilles tendon in this country.